Big news out of the FDA last week as the regulatory group approved a pill version of that popular weight loss drug Wegovy. It's the first daily oral medication approved to treat obesity. A lot of people have had to inject medications like it. To answer all of our GLP-1 questions, we've got Dr. Holly Lofton on the line for us. Doctor, good to see you here. We know that you operate the Medical Weight Management Program at NYU Health First. Doctor, first of all, is the pill effective over those injections?
Well, this is definitely an exciting time in the weight management world. As you mentioned, recently there was the first and only GLP-1 receptor agonist that is oral approved for weight loss. And so, as you mentioned, the drugs are usually injected, and the injectable versions do tend to hold a little bit more efficacy in weight loss. So depending on the injectable, we see between 20 and 23% weight loss, whereas it's slightly lower with the pill at 14 to 17%. But this still is a significant amount of weight loss for one to achieve.
All right, so why though? Why is the pill not as powerful as the injection?
The reason is because these medications are injected subcutaneously and slowly absorbed over a week's time.
Got it.
They don't bypass through the liver. When you take a pill orally, it has to go through the stomach and the liver, and it's not as effective because there's less absorption just because of the type of large molecule that GLP-1 receptor agonists are.
Understood. Okay, so we also know there are compounded versions of these GLP-1s via health startups like Hims. We've seen that advertised, and Hers. What's the difference between these offerings, and are they as effective?
It's important to make this distinction between compounded GLP-1 agonists and FDA-approved GLP-1 agonists. The name brand medications like Wegovy are FDA-approved, meaning they've gone through stringent facility evaluations to make sure that the medication is safe and that it actually is working well. The compounded medications don't go through as stringent of an evaluation for the FDA, so they may not have guaranteed safety or efficacy.
All right, got it. So we're headed into what a lot of people call dry January. Walk me through the effects of GLP-1s on drinking.
Well, it's important to know that GLP-1s are not officially approved to treat any substance abuse disorder, but people who use them do report wanting to drink less alcohol. It just simply isn't as pleasurable. People may feel a little bit more nauseous when they drink alcohol, or the alcohol affects them more than usual at smaller amounts. So this is something people tend to actually think is a favorable side effect of the medication.
All right, bring on the mocktails with 2026. Dr. Holly Lofton, it's good to talk to you. We wish you a beautiful New Year's Eve and a great 2026, and best health to your patients.